Hello, you're welcome to Dr. Erin. Let's talk women health once again. So today we are going to talk about ectopic pregnancy. Have you heard about ectopic pregnancy? Many of us do not know about it unless it happens to you. But today I'm going to tell you how it comes about, the warning signs, the risk factors, and what to do if it happens to you. So normally when the egg has been fertilized, it travels down the fallopian tube to the uterus. But in an ectopic pregnancy, when the egg is fertilized, it gets stuck outside the uterus, which normally occurs in the fallopian tube. And that is what we call an ectopic pregnancy. But since the fallopian tube is a very thin tube that can't accommodate a growing pregnancy, it's going to end up rupturing and causing internal bleeding. So the risk factors for this ectopic pregnancy include using an IUD and still getting pregnant, smoking before conception, previous pelvic diseases like PID and chlamydia, so many things and some people actually get the ectopic pregnancy when they're actually healthy and have not been going through whatever I've mentioned as our risk factors. So normally the early detection is what will save you most of the time with this kind of scenario. So signs and symptoms of having an ectopic pregnancy, because it comes like a normal pregnancy. You're going to miss a period, you're going to have a positive test, you're going to have light vaginal bleeding or spotting, which some will call implantation bleeding, and then you're going to have what makes it stand out and makes you actually go to hospital for checkup is the sharp pain, stabbing pain in your lower abdomen on either side of the abdomen, and also shoulder pain that makes you feel faint and dizzy. So the diagnosis, the best way for you to know you have an ectopic pregnancy is for you to go to a health center or a health worker who is going to ask you to do a pelvic ultrasound, which will show where the fetus or the baby is growing, whether in the fallopian tube or in the uterus or anywhere else outside of the uterus. Or you do blood tests for HCG, because with an ectopic pregnancy, with a normal pregnancy, the HCG levels increase day by day. But with an ectopic pregnancy, they'll increase but at a lower rate than a normal pregnancy. Sometimes now, like for unobliged ovum, like I'll talk about later, they will increase as well, but very slowly, just like they will in an ectopic pregnancy. The best treatment is if you find out early and the fallopian tube has not yet ruptured, they're going to give you methotrexate, which can dissolve the pregnancy. Sometimes if they find when the fallopian tube has ruptured or the pregnancy has grown, you're going to undergo a surgical procedure. So the earlier you find out, the safer and the simpler the procedure for you. An ectopic pregnancy can be really scary, but it is manageable once found out early.